Can you hear me now? Can you hear me now? Okay, let's look at the question here. Okay, now please go for the answer. The following statements regarding the microbe in the picture are correct. More than one option can be true. A, B, C, D, E. Which one is correct, people? Can you please give me an answer? Yes, answer please. Okay, Pankaj Rai says A, B, C, E. Lovely Dubey says B, C, D. Anybody else with an answer? Haripriya says B, C, D. Okay. Surinandana says A, B, C. Phoebe Buffet says B. Hi, Phoebe Buffet. Amir Thoshan says A, B, C, E. Seshu Gopalan says A, B, C. And Parag Sharma says B, D. Okay. So let's start with the answers from the students. Let me give you the answer. I'll mark all the right answers. Now look at this. This is a PGI pattern question. More than one option can be correct, right? So look at this. Option 1 is absolutely correct. Before going for it, can you just tell me what organism are we looking at? What is the microbe under question? Which microbe is under question right away? Excellent. Now you have to understand that you have become better people always. Your human brain is capable of adapting to difficult things. See, some of you might not have made out what exactly the organism is. You might not have understood what the organism is. So at this point of time, you might have actually felt that the question can give you some kind of details. Now from the question, if you can notice, they're speaking about chorioretinitis. They're speaking about congenital infection. They're speaking about microbe-specific IgM antibodies. And they're speaking about congenital infection once again. And if they're speaking about Frankel's test, be it a positive or a negative answer, it all points out towards one organism called as toxoplasma. Now this toxoplasma belongs to a class of organisms called as, that is the phylum would be Apicomplexans. Phylum Apicomplexans. What do you mean by that? If I try to draw an organism among Apicomplexans, the apex will be made up of certain structures. The apex would be made up of certain structures, and these structures are sharp enough to help the organism penetrate through a membrane. If I say an organism can invade through a membrane and it can enter inside, then what kind of organism can they be? What kind of organism can they be? If I say the organism can penetrate and can actually cross the membrane, what kind of organism can they be? Yeah, one point is invasive. I'm saying they're capable of penetrating, so they're invasive. But after invading, what are they settling as? Excellent. See, you're saying invasive. Invasive about the ability of penetration. I'm speaking about penetration done already. Once the penetration is done, it enters into the cell and remains intracellular. So, now look at this. The right answers are A is true. A is true because the most severe form of congenital infection occurs if it is acquired in the first trimester. So, first trimester more than the second trimester more than the third trimester. That would mean to say, if I choose A as the right option, then D cannot be the right answer. I repeat once again, for those people who chose A, it is not correct to choose D. Not just because you understand the logic of the question. Even if you don't know the organism, think about it. Either A should be correct or D should be correct. I am telling you, if first trimester is the most dangerous, then second trimester is less dangerous, third is the least dangerous. At that point of time, if A is a true statement, then D is exactly the opposite of it. It is a false statement right away. Now go for B. The most common manifestations of congenital toxoplasmosis would be hydrocephalus and chorioretinitis. That is understood. So B is also true. Look at this. Presence of microbe-specific IgM antibodies in infant are suggestive of congenital infection is a true statement. I'll just discuss this in a minute. I'll come to this in a minute. Now, what is Frenkel's test? I repeat, Frenkel's test is actually a skin test. And this skin test is known for looking at delayed hypersensitivity reaction. Delayed type of hypersensitivity reaction. This was founded as early as 1948, and this is on the same lines as tuberculin test. It is on the same line as tuberculin test. You inject something intradermally and you elicit a response, right? So Frenkel's test is for toxoplasmosis. Please mark it if at all you haven't known this before. If you know it before, it's absolutely fine. If you haven't known this before, please understand. If the organism is toxoplasmosis, I have not asked the question about congenital toxoplasmosis. I just asked you about toxoplasma as an organism given in the picture. And if that organism is causing infection, then for any other toxoplasmosis, you can go for Frenkel's test, which is positive. Now, what are the most important components of this particular organism? This organism has a Golgi body. You will be surprised because we have come from a different world into a different world. It is not bacteriology anymore. This is protozoology. Under protozoology, all of them are eukaryotic cells. Eukaryotes means they are true cells which contain a true nucleus. So they have a proper nucleus. They have all major kinds of intracellular organelles. And you have a cytostome. The most important structure is rhoptery. This rhoptery is an elongation coming from the tip of the whole organism. So with the help of rhoptery and conoid, can you notice the surface here, which is sharp? This surface is sharp because of which the organism can show enough amount of excellent pancreas. The organism can show invasiveness. Now look at this picture here. This is the life cycle of Toxoplasma gondii. As I have mentioned earlier in all the promotions, I have said that we'll be having 5 MCQs, 5 organisms, if possible 6 MCQs for 6 organisms, and we'll do the life cycles of each of them ultra fast. So I'll do the life cycle of these organisms. Listen very carefully. Now we are starting with the cat. Cat is a very important host for the organism, while you also have other kinds of animals who are generally non-carnivorous animals, who are herbivorous animals. Herbivorous animals. What are the animals you see? You can have pig, you can have a sheep, and you can also have a rat. Now look at this. We are starting the whole cycle with the fecal oocyst. All kinds of protozoa can exist in only 2 forms I have told you. One is trophozoite, the other one is cyst form. Trophozoite is the widely active feeding form, which is the glorious form possible. But cyst is the dormant form. It wants to keep itself protected. It wants to go for reproduction. I repeat once again, trophozoite is the active form. It can move. It does not have much of protection. It is not having a very strong outer covering, but it is capable of moving either with the help of pseudopodia or with the help of specific locomotor organelles. And these kind of organisms in the trophozoite form can be active in the feeding, and they are the ones who cause the clinical manifestations by causing pathogenesis. Cysts are the dormant form. They are trying to keep the organism safe, and they are trying to keep the organism alive and go for reproduction. Here, when I use the word oocyst, this is the dormant form and has come out of the cat feces. Now, how do the human beings acquire the oocyst from the cat? First point, these fecal oocysts can be found in the cat litter. I repeat, the most important keyword is cat litter. If at all you are trying to clean the cat litter, the fecal oocysts coming from the cat can go into your nail bed, and when you actually try to wash your fingers, there is no guarantee the fecal oocysts can be destroyed. And the fecal oocysts can remain under your fingernail beds. So when you eat it, you are ingesting the fecal oocyst. As you ingest the fecal oocyst, you will be able to have the infection happening. So when they ask you, what is the infective form of Toxoplasma gondii? The answer is oocyst, because it is the form that is entering into the human being. What is infection? The mere entry of the organism into the host cell is called as infection. So how did the Toxoplasma enter into the human being here? By contamination of the food or by contamination of your fingers with the fecal oocyst. So what is entering into your body? The fecal oocyst is entering into your body. Now at the same time, can you acquire these organisms, fecal oocyst, from these animals? Yes. If at all the fecal oocyst has been ingested by a pig or a sheep. Why? Pig can graze in the dirty area. Sheep can be grazing in the grassy dirty area. When they are grazing on the grass, if they actually come across the fecal oocyst, the fecal oocyst, instead of going into the human being, they will enter into the GIT of these animals. From there, the organism can actually rupture up and can become tissue cyst. So, fecal oocyst will become tissue cyst inside these animals. And how do we acquire them? We acquire these animals in the form of meat. So the difference is, if you are going to get it from cat, it is by contamination. I'm using the right kind of words. Please watch it very carefully. In kinds of cats, if the cats are the sources, you are getting fecal oocyst. If cats are the sources, you get fecal oocyst, and the method is actually ingestion. By contamination. Contamination of the food, contamination of your fingers. In case of the animals here, you are acquiring it by meat, and what you are getting is tissue cyst. And these tissue cysts will open up inside the body. Inside the body, the cysts will exist. Cyst will open up. The process is called as excistation. And the excistation can give rise to the trophozoites. And these trophozoites can have a different name. I told you the trophozoites can have different names and different kinds of organisms. Here, if the trophozoites multiply very fast, fast means tachy. So, when they multiply very fast, they are called as tachyzoites. And if they are multiplying very slowly, then it is called as brady. They are called as bradyzoites. Why am I teaching you this here? Remember, in a question paper, if you understand it is a parasitology question and if they use the word tachy and brady without any kind of second thought, please go for toxoplasma, because no other organism has these words called as tachyzoites and bradyzoites. Now, if at all they are trying to multiply so fast, they don't have enough time to grow bigger. So, tachyzoites will be tiny, tiny, T for T, tiny. Bradyzoites have a lot of time to grow, increase size. So, brady means bigger. So, bigger trophozoites are called as bradyzoites and tiny trophozoites are called as tachyzoites. Tachy, fast, brady, slow. So, these are the properties I wanted to know. Now, what is the next information you have to know? Bradyzoites are the ones who can go and deposit in the tissue and they can become tissue cysts once again. While tachyzoites are the ones who can float in the blood. Because they're smaller size, they can float in the blood, they can cross the placenta, they can enter into the fetal circulation. Enter into fetal circulation. So I hope hypnozoid, Parag Sharma, hypnozoid does not come in this logic at all. Hypnozoid comes in the organism called as plasmodium, and especially in case of non-falciparum, non-malarial organism. In those areas, you will be having certain kind of merozoites. These merozoites of plasmodium who come out of the RBC, they will enter once again into the liver and they remain quiet. So, the quiescent period of the merozoites inside the liver is called as hypnozoites. Why hypno? Because they are in the hypnotized state, they are actually sleeping. They'll take a lot of time before they get activated. So, hypnozoites is not a concept used in case of toxoplasma. So, in toxoplasma, you have trophozoites which are called as tachyzoites and bradyzoites. Now, coming to this question here, in this question, we saw a statement. We asked whether you will be having IgM antibodies. Now, I'll erase whatever I have written here. Look at this. I'll erase whatever I have written here. In this condition, you have to understand IgM is the antibody who cannot cross the placenta, while IgG is the only antibody who can cross the placenta. So, if this is the mother circulation, if this is the fetal circulation, if at all you see in the fetal circulation the IgG antibody, you are not very sure whether the IgG antibody came from the fetus itself or it crossed passively from the mother. But if you find IgM antibodies in the fetus itself, because of the understanding that IgM would not have crossed from the mother, IgM purely belongs to the fetus. So it means the fetal infection has happened. So conjugate infection has happened. So please remember, presence of microbe specific IgM antibodies or toxoplasma specific IgM antibodies in an infant is a clear indication of congenital infection. So if you're okay with this, can I go to the next question, please? Shall we go to the next question? Excellent. Now look at this picture here. Don't answer anything. Just look at the organism. I'm going to give you 30 seconds for this picture. IgA can also be used. No, IgA cannot be used in case of toxoplasma. It doesn't have a role at all. Okay. Now go for the question. This is the microbe. I am not telling you which form you're looking at. You just have to make your mind what form you're looking at. Now look at the question. The stool in the given organism's infection may contain A. High fecal content, B. Blood, C. Fatty acid crystals, D. Charcoal laden crystals. Tell me which are the true statements here. Saram says it is D. Anybody else with the answer? Okay, Naveenashree, Muthukumaran, all, Mithul Karmakar, Aishwarya Verma, all of you have said D. Okay, so you have forgotten one thing. This is a PGI pattern question. Every question can have at least more than one true option being correct. So you have missed out on it. You can take one more chance. Tell me what other can be the right answer here. Okay, so B and D is what Parag Sharma is saying. Seshugopalan says B. Priyanka says BD. Okay, let's not take any more answers. Can you tell me what is the organism you are looking at here? What organism is this? Can any of you tell me? B and D. Asya Yumna says A. Haripriya says CD. Okay, can you tell me what organism we are looking at? Excellent, Vamsi. C and D. Cryptosporidium. Okay, it is not Cryptosporidium. It came so close. Excellent. It is Isospora. Amazing. No. It is not Lumbricoides. Mithul Karmarkar. If you say it is Lumbricoides, it is Ascaris. No, this is not a helminth. This is not a helminth. It is a protozoa. This is a protozoa belonging to the phylum called as Apicomplexa. Under Apicomplexa, we have a class called as Sporozoa. Sporozoa has three major organisms among the extracellular group called as Cryptosporidium, Isospora, Cyclospora. In that, this belongs to Isospora belli. So I'll write the causative organism here. It is Isospora belli. And why is it important for you to know whether it is Isospora belli or not? Why is it important to know it is a protozoan among the Sporozoan family or not? Because if you take any of these three organisms, Cryptosporidium, Isospora, Cyclospora, all these three organisms are known for causing only diarrhea. Please understand, they are known for causing only diarrhea. They cannot cause dysentery. Among protozoan organisms, the only organism known for causing dysentery would be Entamoeba histolytica. Even in case of amoebiasis, only Entamoeba histolytica, histo, tissue, lytica, breakdown. So only that is capable of causing dysentery, not even Entamoeba gingivalis or Entamoeba coli. They are all capable of causing only diarrhea. And in fact, Entamoeba gingivalis is absolutely a commensal. It can never cause any kind of disease as such, even if a patient is having AIDS. Mark my words. In generally, if an organism is actually infecting you, if you have HIV/AIDS, the ability of the organism to attack you will be very higher. But that is not the case in case of Entamoeba. Entamoeba attacks both HIV or non-HIV people with the same kind of propensity and intensity. So here, the most important thing is blood is a false statement. Blood should not be seen in the given question. High fecal content is absolutely yes. Initially, it can be high fecal content, slowly moving towards watery diarrhea. This is possible. And remember, I am saying this particular Cyclospora and Isospora belli are right now called as site isospora. According to the new terminologies, they can use it as site isospora, but you can still call it as Isospora belli. Remember, initially they'll be having high fecal content. It can turn into watery diarrhea. So option A is not all the time true. It is true. Next, you can have fatty acid crystals and Charcot-Teyden crystals. Charcot-Teyden crystals, you understand from the beginning of your inflammatory chapters and the pathology, you'll understand what is the meaning of Charcot-Teyden crystals. So make sure you remember this. So A, C and D are true. The only thing that you're not supposed to pick up would be B. Blood will not be a part. Excellent. Good evening. Confused between Isospora and Cyclospora. Don't worry about it. This is the picture of Isospora right now. You can search for Cyclospora under Google. We don't have time to differentiate between two organisms. I will do it if at all you want me in the next class. Now look at this picture here. You are looking at the cyst and also the trophozoite. Remember, the oocyst of Cyclospora, the oocyst of Cyclospora, or simply the cyst of Cyclospora, can actually be AFB positive. That is AF positive, acid fast. Why? Because of the toughness of the cyst wall. The cyst wall of Cyclospora, Isospora, Cryptosporidium are all tough, because of which they can resist the decolorizing effect of acid called as sulfuric acid. So they can be acid fast. Now this is in short the life cycle of isosporiasis. Just be with me. The whole thing starts from here. Now a human being can release the organism called as Isospora in the feces. So it will be coming out as oocyst. Excellent. Now this oocyst will become sporoblast. Immature oocyst will form sporoblast. Now this immature oocyst will become sporocysts. I repeat once again, we have the concept called as oocysts. The oocysts will contain sporoblast, and these sporoblasts will go for maturation to become sporocysts, and these sporocysts will actually become mature oocyst plus sporozoite. Now these mature oocyst and sporozoite will again enter into the human being. This concept is called as contamination. Very poor method of hygiene. You are not maintaining proper hygiene when you are eating your food. Now what exactly happens inside the body? Mark my words, isosporiasis, cyclosporiasis, cryptosporidiasis, all these come under sporozoa of the apicomplexan category. Remember, in the whole of protozoology, apicomplexans are the ones where you can have two life hosts. One can be a definitive host, the other can be the intermediate host. The concept of definitive intermediate host can be present in case of your apicomplexans, but it is not completely definitive host and intermediate host in case of cyclospora, isospora and cryptospora, but the definitive host and intermediate host are clear concepts in case of plasmodium, toxoplasma, babesia. So what have I cleared it right now here? I am just telling you, when you take the phylum Apicomplexa, and why am I asking about, I believe that you know the phylum Apicomplexan, because in the previous week's class when we had Ames based discussion of parasitology, I gave you the life cycle, I gave you the span. I also told you the classification of all the parasites. So you can go back and watch that particular slide, Ames discussion on images. I said there are 4 phylum. One phylum is Sarcomastigophora, next one is Apicomplexan, third one is Celiophora, fourth one can be your Microspora. Under them, we were focusing only on this Apicomplexan. Apex is sharper, and the apex, when being sharper, it is capable of penetrating deeper, I said. Now here, these isospora, cyclospora, cryptosporidium are unique in apicomplexans. Though they have a sharper edge, they are not highly invasive like that of plasmodium, toxoplasma and babesia. Why? Plasmodium and babesia are invasive. They can become intracellular inside the RBC. While toxoplasma is also invasive, it becomes just intracellular inside the macrophages, or it can cross over the placental membrane. So look at this here. We are looking at what exactly they will do inside the human body. Inside the human body, the mature oocyst will open up to become the sporozoite, right? This is what is the plan. I will erase all the annotations I have given here. Oh my god, I'm not able to erase the annotations. Yes, I have erased all the annotations. Now look at this. What went inside was mature oocyst plus sporozoite. Mature oocyst plus sporozoite. So when they ask you what is the infective form of the organism for human beings for isosporiasis, the answer is the sporozoite. The sporozoite comes out of the mature oocyst and can actually become merozoites inside the cells, and they can have different kinds of shape. Now from the cell, they can actually give you microgamete. That microgamete can go for fertilization, and they can go for sexual reproduction, and they'll come out as oocyst in the feces. So what happens here? When they first came inside, they were asexual. Now then they move towards the intestine. Now in the intestine, they can actually become types of merozoites to that of sporozoites. Then they can actually become microgametes. Now the microgametes can actually fuse along with the macrogametes. The macrogamete is the female, the microgamete is the male. They can fuse and they will give you the oocyst ultimately. So now when it comes out of the feces, it comes out as oocyst. So I repeat once again, this cycle is starting and ending with one single definitive host, that is a host which is called as human being. So this is the exception for Cyclospora, Isospora, Cryptosporidium compared to the remaining 3 organisms under Apicomplexan. Apicomplexan has 6 organisms: Plasmodium, Toxoplasma, Babesia on one side, Cyclospora, Isospora, Cryptosporidium on the other side. Cyclospora, Cryptosporidium, Isospora, you will be having the word spora attached to them. All these organisms can live inside the lumen of the GIT. They can attack the GI epithelial cells also. Now they have only one host called as human being. But in case of Plasmodium and Babesia and Toxoplasma, you can have more than one host. So the concepts of definitive host and intermediate host will be very common in case of Plasmodium, Toxoplasma and Babesia, not in case of Cyclospora, Isospora, Cryptosporidium. So here the whole thing starts with the mature oocyst giving you sporozoite, and what comes out is a oocyst in the feces, which is immature oocyst. So immature oocyst comes out, mature oocyst with sporozoite goes inside, the life cycle is over. Now let me go to the next question. Now look at the picture here. Look at the picture here. Okay, so you don't have to tell me which organism it is. Okay, good, Sheshagopalan. Don't have to tell me this. Just look at the question right away. The associated features of the microbe whose egg is seen in the picture are. Now take your time. You have A, B, C, D, E, F, G, H. Out of 8 options, you are supposed to choose me which are the right options given here. Go for it. A, mild intestinal distress. B, sleepiness or sleeplessness and itching. C, anxiety in preschool child attending play school. D, enuresis. E, abdominal pain. F, nematodes lay larvae. G, nematodes lay eggs containing larvae. H, nematodes lay just the eggs which after hatching can give rise to adult worms. So go for the answers. Okay, time has started now. I'll continue for 10 more minutes to finish this topic. Okay, Prashna say, Harini Prashna says ABCG. Okay, Surinandana says ABCDEH. Okay, ABCEG. Parag Sharma says ABE. Phoebe Buffet says ABCEG. Okay, please go for it. You have 10 more seconds to give an answer. ABCE. Okay. Okay, let's stop getting answers from you. Let's go for it. Now the given organism is Enterobius vermicularis. Can any of you tell me which age group is the most commonly affected? I'll tell you the answer. In the early childhood. The most common age group affected would be early childhood, and they acquire it from the play school generally. So whenever they use the word child attending play school, please think about Enterobius vermicularis. And the most important property you have to understand is it is called as seat worm. The toilet seat can actually help in the spreading of the organism was the belief. That's why it was called as seat worm. And this organism can lay the eggs. The eggs will look like coffee bean. Look at this here. It looks like Coorg coffee beans in one way, and the other way they look like lens. They look like lens. One edge is curved, the other edge may appear flatter. And why one edge is curved, why one side is flatter? It is because of the larva present inside. For those people who didn't see it properly, if you watch very carefully, what is present inside the egg is actually the larva that is folded. The larva in the folded version is what is giving the shape for the whole particular egg. What do you see here? If you notice, in this area the larva's portion is actually straight, but in this area the larva is need to be packed more. That is why there is a curvature here. So what you are seeing inside is a curve, but you'll see as if it's a division as a straight line, and that is the division that gives you a look like it is a coffee bean. So these are the Enterobius vermicularis eggs. If the organism is Enterobius vermicularis, then what is the child telling you? The child always has mild intestinal distress, which can progress to become abdominal pain. So both A and E are true. Next, because of the abdominal pain and because of the distress the child is always facing, the child will have some basic kind of anxiety. The child does not know how to explain the difficulty to people. Even the father and mother will not be able to come across it. So it will create psychological symptoms. And the most common psychological symptom that you see among a patient, psychological disorder that you see in these kind of children would be anxiety. And where? In preschool, when the child is attending the play school. And here, because of this condition, anxiety, what you see as anxiety throughout the day will boil out as enuresis in the night. So that is bedwetting. The child will actually urinate in the bed. So enuresis is also true. So it means anxiety is also true. The sleeplessness and itching will always be present. And this itching will be very specifically perianal. Perianal itching. Around the anal canal, the child will not be able to bear it. It keeps on itching. And the children and the parents will think that the child is not having enough amount of manners. They will blame themselves. They will blame the child. They can be angry with the child. But remember, this particular worm is trying to wiggle out of the anal canal and tries to deposit these eggs on the perianal region. And as it keeps on wiggling and touching the perianal area, Every time it touches the perianal area as a touch not touches pattern, it keeps on stimulating some kind of nerves in the local area. It will make you feel like scratching it. The more you keep on scratching it, you will get these eggs coming into the nail bed. And once you will have the organism in your nail bed, when you try to scratch your anal canal and then you try to wash your hands, still the eggs will be present, and now the eggs can go into your mouth if at all you do not take proper precautions. You don't know it, right? Because you don't know it, you will not know whether the eggs are present in your nail bed. When you swallow it, you are eating it. So this is an example of auto-inoculation. Mark my words, one organism known for auto-inoculation is Enterobius vermicularis. But this is not the same in case of Entamoeba histolytica or Toxoplasma. There it was not auto-inoculation. In case of Enterobius, you defecated it, and that defecated material contained the eggs. The eggs were lodged in the perianal area. When you scratch the area, you get the organism again. So you deliver, you take in. You deliver, you take in. But in case of Toxoplasma, the cat delivered, you took in. In case of Entamoeba histolytica, the eggs were from somewhere else and you took it by food, and then you defecated. The cyst will be traveling to other areas. The cyst will not be staying in your perianal region. Okay, now the most important difficulty is to choose between F, G and H. For those people who don't understand what exactly is the meaning behind or the difference between F, G and H, I'll tell you. Nematodes means they're speaking about adult worms per se. These are the roundworms. They are a group of organisms called as roundworms. Among roundworms, there is another organism called as roundworm, which is Ascaris lumbricoides. But all the worms with the cylindrical body are called as roundworms. In that, nematodes, if they lay eggs, they are called as oviparous. If they directly give rise to larvae, they are called as viviparous. And if they lay out egg, the egg will give you larvae, and the larvae become adult, then that is called as ovoviviparous. Now this is a case where the nematodes will lay eggs containing the larva. So F is wrong. Nematodes don't lay the larva directly, and nematodes lay the eggs which after hatching can become larva. They can't become adult worms directly. So H and F are wrong. G is the right statement. So we'll move forward. Yes, perianal pruritus, tadpole larva, amazing. Plano-convex, amazing, amazing. I'm sorry I was not able to read your comments. Thank you, very good answering. Now let's go for the life cycle here. Just look at it. So what is the infective form of Enterobius vermicularis? It is the egg, and this egg is swallowed, and the egg will go into the intestine. In the intestine, it will latch. The larvae will be hatching out. So when the larvae hatch, they will latch on to the small intestine, and in the small intestine, the larva will keep on developing, and when they reach your large intestine, that is the cecum, they can divide into males and females. In the cecum, they can go for sexual copulation, and when they copulate, they can give rise to the eggs. The eggs will come out through these anal canal. So eggs on the perianal folds, larvae inside the eggs are seen, and they mature within 4 to 6 hours. And these kind of eggs, if they're present in a nail bed, they can go for auto-inoculation. This is the life cycle of Enterobius vermicularis, also referred to as seatworm. Now let's go for the next question here. Look at the egg here. Don't give me which organism it is. Just look at the egg for a minute. I'll give you 15 seconds. Don't give me which organism it is, because it is not important for me to find the organism right away. Just look at the egg. Now, if you are done looking at the egg, we'll go for the question. Pick the true statements about the given picture. We have A, B, C, D, E, F, G, H, I. This is called as intensifier pattern for PGI Chandigarh. In PGI Chandigarh, you can have a maximum of 5 responses, out of which more than 1 can be true. Now I'm giving you 9 responses. Now it can be even more tougher and challenging for you. Once you start preparing at this level, you will never make a mistake at any level. So about the given organism, can you pick out which statements are true? You have an answer, people? No answer? Can you hear me? Okay. CEH, ACEH, ABCF. Any other answer, people? Okay. CEH, ACEH, ABCF. Any other answer, people? IHFEA. Very good. Aishwarya Verma. Mithul Karmakar. Thank you. Suryanandana, ABCF. Okay. Gopika Shri says ACDEF. Okay. Fine. Now, can any of you tell me which organism we were looking at? The egg belongs to which organism? Okay. Fine. Now, can any of you tell me which organism we were looking at? The egg belongs to which organism? Okay, I'll tell you. The egg belongs to hookworm. Most possibly, it can either be Necator americanus or it can be Ankylostoma duodenale. But the picture I show you is belonging to the egg of Ankylostoma duodenale. And what is the most important differentiating point about the egg of Ankylostoma duodenale? This is called as pencil thin cortex. Mark my words, it is pencil thin cortex. If you look at the central area, it is actually heavily loaded. But when you look at the cortical area, the cortex is very, very thin. So this is directly indicative of hookworm as the worm. And hookworm's copulatory bursa has 13 rays. That is a true statement. Don't worry about this. Only when you read the theory of this organism very well, you will be able to answer. It can be a slightly challenging statement. But look at this. Caudal spine is present in females is a true statement. A is also a true statement. But the head is bent in the direction opposite to the body is not a true statement. If I say this is being bent like this, the head also will be bent in the same direction opposite to the body. I am saying that it is in the same direction to the body, not opposite to it. So option C is false. Vulval opening is situated in the middle of the body is a true statement. Biliary tract obstruction is not caused by hookworm. The option E is caused by roundworm, which is Ascaris lumbricoides. Rhabditiform larva is not the infective form, it is the feeding form. Rhabditiform larva is the feeding form, while filariform larva is the infective form. Eggs are the transmission forms is absolutely wrong. Adult worm is infecting is absolutely wrong. So what are the true statements here? I'll mark it here. A is true, B is true, C is false, D is true, E is false, F is false, G is true. So we have A, B, D, G. If at all you have given me an answer of A, B, D, G, you will be an amazing student. You are going to be an amazing student. You are going to be successful in all the exams. And for those people who came very closer, if you work a bit more, you will definitely be able to crack the PGI Chandigarh this year. Now, this is the egg with the larva inside. Here, you did not see the differentiation between the egg and the larva. You see the central mass. It is not properly demarcated into larva. It is not properly demarcated as larva. But here, you will be able to see it as larva. Can you name an organism before we saw where the egg was showing you the pattern of the larva? For which organism I spoke about the egg along with the larva? Just now I spoke. Okay, doesn't matter. The organism was Enterobius vermicularis, where we spoke about the egg along with the worm. Now I wanted to answer. Pick the eggs whose microbes is or are related to bloody diarrhea. Among these organisms, this is A, this is B, this is C, this is D. Now, let's have this as the last question. This is the last question for the day. Just tell me, pick up the eggs whose microbes are related to bloody diarrhea. Pick the eggs whose microbes is or are related to blood diarrhea. A, B, C, D. Okay, you're saying C. Nikita Chaudhary says CB. Surya Vaddi says C. Lovely Dubey says C. Okay, excellent. Okay, Sai Pradeep is saying C, C, A, C. Okay. Now, can you tell me A belongs to which organism? A belongs to which organism? Okay, many of you have given me the answer C. Sri Lakshmi says B and C. Can you tell me A belongs to which organism? The egg A belongs to which organism? When you say schistosoma, it is not correct. Purni, you are saying entrobius. Definitely not. This is not entrobius picture. The picture A belongs to schistosoma. Which schistosoma is the most important question? The answer is schistosoma hematobium. And the next is the organism called as schistosoma japonicum. B is schistosoma japonicum. And D is schistosoma mansoni. And C is Entamoeba histolytica cyst. Now what is the difference here? A, B and D all are helminths. And what will helminths give out? They give you eggs. And C is a protozoa. Protozoa will not give you eggs, they will give you cysts. So when I use the word pick the eggs, you are not supposed to go for C at all, though C can be involved in blood diarrhea. Please mark my words, I said pick the eggs. So what you saw here is not an egg, it is a cyst. Cyst does not belong to helminths, cyst will belong to protozoa. So please mark my words, you will not be able to choose C, not because it cannot cause blood diarrhea. It is known for causing bloody diarrhea. The whole of protozoology, Entamoeba histolytica is the number one organism who is known for causing blood in the diarrhea, but you are not able to choose it because it is not an egg, it is a cyst. Next is, you can go for A. A is schistosoma hematobium, and hematobium is launching itself and stays inside the genitourinary tract. So if at all it is going to use the sharp spine, mark my words, the most important property you have to remember about the eggs of schistosoma is the spinous projections of the egg. Now if it is, I'll draw another paper and draw another picture here. If the egg is oval like this and the egg is having a sharp straight spine, if this is the axis of the egg, it has a sharp spine, straight spine, it is called as hematobium. And if it is having a spine on the lateral side, if this is the axis, but the spine is on the lateral side, it is mansoni. And if you are looking at the egg which is having a hook-like projection, it is called as japonicum. And in that, I wanted to understand one thing. Hematobium does not attack GIT, it attacks GUT. So japonicum and mansoni are the ones who are present in the GIT. They are present in the GIT as the adult worm itself. They are capable of causing diarrhea. And when they cause diarrhea, you can have the eggs coming out. And if the eggs are having a sharp projection because of which they can injure the GIT, they can cause bloody diarrhea. I hope you got your answer here. Now look at the life cycle here. Yes, now look at the life cycle here. Here we are starting with this. What enters into the human being is a cercariae. Remember, it is not going through the oral cavity, it is penetration of skin. So the infective form of schistosome, be it hematobium or japonicum or mansoni, it is the cercariae. And cercariae is very sharp, it can penetrate through the skin. Through the skin, it can enter into your body and can enter in here in such a way that you will be able to have the A and B sorts. That is, you will have the larva entering into the human being. The larva develops into the adult inside the human being. What is the definition of definitive host in case of helminthology? In helminthology, definitive host is the host in which adult form is seen, or the form in which the larva becomes adult form. So here the larva is entering inside and becomes adult worm, and that adult worm will be present here in the GIT, and they will give out the larva, they will give out the egg. Now remember, the adult worm of hematobium will be living in the adult worm of hematobium, I'll write it here. Adult worm of hematobium will be living in the vesicle plexus. Watch the spelling here. It is not VESICLE. Vesicle is a skin lesion. Here this is vesicle, which is the bladder, urinary bladder veins. If this is the urinary bladder, the adult worms will be living in the veins of the urinary bladder, and when they deliver the eggs because of sharp projection can jump into the bladder. Through the bladder they can come out in the urine. So for hematobium, the blood vessels of the bladder are carrying the adult worms, the eggs are coming out in the bladder. But in case of mansoni and japonicum, the blood vessels of the GIT are carrying the adult worms, and when the adult worms will deliver the egg will project and come into the intestine and they'll come out in the feces. So mark my words, in case of schistosoma hematobium, if you want to look at the egg, it is urine. If it is mansoni and japonicum, you look at it in the feces. That is the difference. And they can cause blood diarrhea if at all the spinous egg is causing injury to the mucosa of the GIT. And why am I not choosing Entamoeba histolytica in this question? Because I have used the word egg. Entamoeba histolytica does not have a egg, it has cyst. So we have come to the last part here. Now we'll stop with this. Now I'll be having a session at 7 p.m. In just another 5 to 10 minutes, I'll be having a session on molecular biology techniques. I have a session on molecular biology techniques. We'll be doing PCR and RT-PCR and the applications of these in medical field. You can follow me on Unacademy by searching for this particular name, Meenakshi Sundaram AS. You can follow me on Instagram. You can join my Telegram channel by searching for Meenakshi Sundaram AS. From the channel, you can come to my group. You will be able to receive all the updates about the free classes. So this is my FB page. You can follow me there. The 7 p.m. class is actually a free session. It is for 1 hour. For those people who are interested in learning about molecular biology techniques, please feel free to come and join this. This class will be on the Unacademy app. And if at all you want to watch previous of my YouTube videos, you can go below this area and can see the playlist. If you click on the playlist, all the previous videos in the last 2.5 months will be shown to you. And for all the people who have actually been here with me and try to answer all the questions, thank you very much. I'm really glad that you were very cooperative in this class, and thank you for playing along. Have a good day. I'll meet you next Sunday by 8 p.m. or 9 p.m. I'll give you the information and notification soon. Thank you, people. Bye-bye.